Good afternoon and welcome to the Digital Innovations Virtual Showcase. This is the last webinar that we've got of a series of events that we've had for the virtual AGM this year. My name's Mark Stanton and I'm Chief Information Officer for the Trust. I think that's IT Director in old money for those of you who are not familiar with this area. So what we've got today is we've got our digital team here, and they'll introduce themselves as we go along, and we're going to take you through some of the work that we've done this year pre and post COVID-19. Just before we start, I'd just like to say that everybody in front of the camera is at least 2 meters apart, and everyone behind is also practicing social distancing as well. So moving on is that I've been at the Trust now for just over a year, and I think that the first part of the 2019-2020 year was spent around the Lorenzo stabilisation piece. So those of you that have been involved with the Trust for any number of years will have known that we had some challenges with Lorenzo historically since the implementation. But I'm glad to say that we've now got a working system. We've got good engagement. Discharges are going out on time. Discharges are going to GPs on time, and we're in a really good position now to start building on Lorenzo for the future. So that was the first part of the year. The other two pieces really that we focused on pre-COVID-19, the first was around stabilising the infrastructure. So again, like Lorenzo, we had some challenge with our infrastructure. Most of the components were around about a decade old. And if we take us on to the next slide, there's some interesting numbers on there. So 400 pieces of network equipment, for example, were replaced last year. So the intention was to stable that infrastructure. And I'm glad to say that we've now got to a position of both our local infrastructure, so the network on the site, and indeed the network connectivity off of the site is now in a really good position. As of Thursday, in fact, this week, our network is now nearly 10 times faster than it was earlier on in the week, which is a significant change for us. The other piece of work that we were involved in early on in the year is around electronic prescribing and medicines administration. So that's to say, moving from paper prescribing to a safe digital solution on the wards. But I won't describe that in too much detail because we have actually got a video later on. So that's by way of a summary is what we're doing today. I'd like to now hand you over to Emma, who will take you through some of the work that we've done this year in a bit more detail.
Thank you very much, Mark. As Mark said, my name is Emma. I'm extremely proud to be the head of our digital portfolio for the Trust. Part of my role is to control and manage demand for digital innovations to ensure that we deliver a portfolio of projects that together make the greatest contribution to achieving the strategic goals of the Trust and the delivery of our digital strategy. Our end goal is to ensure that we provide our staff with the most efficient and effective way to access their clinical information and clinical decision-making tools and guidelines, which in turn enables our clinicians to achieve high-quality, compassionate care for all of our patients. So you may wonder how we facilitate these projects. In the past year, we have been extremely fortunate to expand our delivery team. This now incorporates an extremely talented group of digital delivery managers. These managers are assigned to work collaboratively with our clinical and non-clinical teams and are passionate and proud to deliver digital transformation for our patients and staff. The team have delivered a number of projects over the last year, which have delivered various benefits for the Trust. These benefits range from projects that deliver clinical safety, mandatory changes, requirements set by our governing bodies, efficiency gains, performance enhancements, and financial savings, just to name a few. Now, one of the projects that our digital delivery team are extremely proud to have been part of during this last year is the implementation of our electronic prescribing and medicines administration project, also known as EPMA to our colleagues. This is a further step to achieving a full electronic patient record by transferring all paper-based patient records into a digital format. This project took our traditional paper-based approach to prescribing medicines into an integrated digital solution. We worked collaboratively with our pharmacy team, clinicians, nursing colleagues, and was supported by NHS Digital. I'd now like to show you a video of our pharmacy team who are going to provide an insight into the project and the benefits that were delivered. So I'm sure you'll agree that that's a fantastic example of how digital can provide benefits to our clinical teams. So another collaborative project that our digital team are proud to have been part of is the introduction of a digital infection control solution called ICNet. Our digital team worked in collaboration with our infection prevention and control team to go from having a paper-based solution where daily spreadsheets were used by staff to manually update and alert electronic systems. The new infection prevention and control surveillance system provides a trust-wide electronic case management, immediate alerting of information relevant to the infection control, and in-depth real-time reporting. All of the above improves the clinical safety for our patients. I'd now like to introduce a video of our lead infection prevention and control nurse who will talk about the benefits of the solution.
So thank you for all of our contributors there, and I hope that gives you a flavour, a very small flavour of some of the projects you'll be working on. And I think also you've probably noticed so far that we've not actually presented any block diagrams or network flows or the type of presentation that IT people like to do. And that's because what we think is important is actually the technology we deliver. It's important to see what it actually does for the people that we're delivering it for, and ultimately what the outcome is. So that's what you've seen in those videos, and hopefully you'll see that in the videos that follow. So as I said earlier on, is that there's been two parts to this year. There was pre, and then there's obviously post-pandemic. It's very difficult for us to think back anything before COVID-19 at the moment, because we've been pretty much immersed in this 24/7. When we think back to February and March, the challenge we had, like every trust in the country and probably every business in the country, is we've clearly got a hospital that was configured in the traditional sense. So people went to meeting rooms to have meetings. We have around about 5,000 PCs on the site, and predominantly these are in fixed locations. Once COVID-19 had hit us, then clearly we started restructuring our hospital. It was a very different place. There were certain wards that we couldn't go to without PPE. People couldn't move around and go to meetings. And we also had a large number of people who had to self-isolate, whether that was for shielding or whether they had symptoms of COVID-19. So that gave us a very different landscape to deal with. Clearly, the digital response was that there was a digital response required for this. So very early on, we started looking at how our staff would communicate, and more importantly, how people would still be able to deliver patient care. So we've got a number of videos coming up around some of the innovation that's in that space, and some of it is relatively straightforward, but very powerful. I think that probably in terms of the complex piece that we delivered was a technology that we call Digital Workspace. For those of you who are interested, it's built on a technology called VDI. This is a piece of technology that allows our clinicians, or indeed any of our teams, to be able to work from home and use their own piece of equipment, whether that's an Apple Mac, a PC, an iPad, to log on to all of the systems securely and be able to carry out their role. So that meant that doctors that were isolating were able to do triage, for example, and then starting to move on to virtual clinics, which we've got some information on. So there was a lot of work took place, obviously under challenging conditions, because like the rest of the trust, then a number of the IT team were working from home, or we gave our office space up to enable clinical functions to move into our office space. So what's coming up now is a number of videos and presentations around some of the work that we did to support our colleagues on COVID-19. So I'm going to hand you over to Ollie now, who will introduce this for you.
Thanks, Mark. Hi, everyone. My name's Ollie, and I'm the Digital Operations Director here at the Trust. I'm responsible for all digital hardware and software and the day-to-day running of support digital services. So I'm very happy and proud to present to you today some of the work our digital team have done to aid the Trust's response to COVID-19. COVID-19 was and continues to be a challenging time for us all. But through all of the mixed emotions, some fantastic digital deliveries have taken place. A lot of our deliveries have been designed to help staff and make their interaction with new digital services as efficient as possible. But also, many solutions have been designed to directly help our patients, relatives, and carers. The slide on your screen, as you can see now, displays 4 of our most recent deliveries, in which are discussed in more detail later. We have many pictures of the journey that we have taken so far, and we also have a few videos to play you, which Mark said earlier, which will describe some of the solutions from the staff and the patient's perspective. Next slide, please. This is a similar slide to what we saw earlier in Mark's presentation, and simply shows some high-level figures of achievements over the COVID period to date. I won't discuss them all now, but I do wish to pick out a few of them. First one I wish to pick out is 848 virtual consultations. What does that mean? Well, rather than me take you through what this means, what we'll do is we'll play a short video now of Soraya Brooks, who is our Deputy General Manager for Children's Services, who has kindly agreed to describe the service for us. A great example there of how we are transforming face-to-face services into one where more digital views can actually be seen, and these benefit the patients, the carers, and the staff that are all involved and experience that service. The other subject I want to take you through is 1,500 home workers enablement. Effectively, what that means is through COVID-19, it will not surprise you that the way the trust staff continue to provide their services had to become a lot more flexible, especially for those that needed to shield or isolate. In many cases, the individuals are absolutely fine to continue work, but we need to provide them the tools in which to do so. Over the last 3 months, through provisioning software and hardware, we have successfully enabled 1,500 staff across our trust to work more flexibly, enabling them and all departments and services across the trust to remain operational. Next slide. Next slide is staff communication. So I think up on the screen it says patient communication and entertainment. That's not the next slide. That's it. So next slide is staff communication. During COVID-19, the world has seen a massive shift in the way we communicate with friends, family, and loved ones. Because of isolating, shielding, and lockdown, using apps like FaceTime, Zoom, Skype have become a common thing in many households. The same thing can be said for the NHS. Video calling and instant messaging apps like MS Teams and Starleaf are now a must-have within the NHS. The way we communicate in all areas of our lives has now changed. Instant messaging being preferred over email and video calling being preferred to face-to-face meetings is now the new normal. Here at Eastern North Hearts, we have embraced the need for change, and we're very quick to implement trust-wide instant messaging and video calling. Within 1 week of the trust calling a major incident in response to COVID-19, we had this functionality operational and live. You can actually see from the slide on your screen, there are some amazing stats and show how much of our communication has actually been transformed to date. Nearly 27,000 hours of video calls, nearly 8,000 individual video meetings, 230,000 instant messages sent. All of those figures in just the space of 14 weeks. I think it's amazing. Next slide, please. Thank you. The next subject I wish to speak to you about is patient communication and entertainment. Rather than myself describe this service, though, we will play a short video of Angela Fenn, who is our lead butterfly volunteer, who will take you through the benefits from her perspective. Could you go back to the previous slide, please? Thank you. As you can see from the slide, we have deployed 140 devices to all of our wards across the trust. 3,140 calls have actually been made through this solution. 922 hours have actually been spent between patients and loved ones speaking over video, which I think is great. Next slide, please. I wish to play you one further short video of Angela Fenn, where she is actually using the devices to video call a relative of a patient to give you an idea of how simple and effective the service is. The devices that you actually saw in the video there also have entertainment services preloaded onto them. This gives patients and staff access to digital magazines, newspapers, and also a variety of games and internet access. Many people were involved in this powerful solution. I want to thank you, Angela, and the Butterfly volunteers for their support. Thank you also to Wi-Fi Spark and Visionable for their donations and support. This service has now been live for 12 weeks, and I hope you can see how much positive impact it has had on our patients, their loved ones, and staff. I'll now pass you over to Emily. Thank you.
Hello, my name is Emily, and I'm the Digital Solutions Director here at the Trust. My role is to ensure that all of our digital solutions are designed and developed in a robust way, and that they meet clinical and operational requirements. Today, I would like to talk to you about a government initiative that required the Trust to test all of our staff for COVID antibodies. And I will also try to describe how digital enabled that process to be robust and fully electronic. So what did we do? Well, we started off with setting up a contact center facility that enabled, very similarly to what you have in a bank or in a broadband provider, etc., where 10 agents were able to answer the calls at the same time. That enabled us to control the queue and actually provide a booking facility that ensured that there were no queues in the corridor and people didn't have to wait for a long time to have their bloods taken. The whole purpose of the contact center was to ensure that we had an electronic record of each and every member of staff. And we started an electronic journey of a patient record for them and for the bloods to be traced throughout the system. We had a very positive response. Over the first 8 hours of the contact center being open, we took over 1,000 phone calls. We didn't answer all of them, but fortunately we were able to control, like I said, control the queue and ensure that people were seen within 15 to 25 minutes on average when they actually came for a blood test. Once the pathology labs processed the queues, we used one of our existing automated pieces of software that allowed us to view the electronic results in real time, and that in the results enabled us to automatically send text messages and text notifications to staff, informing them of their result. The overall turnaround time from registration all the way through to a staff member receiving their results took on average between 3 and 4 days, which is much better in comparison to our neighbouring trusts. I would like to now introduce a video of my colleagues Natasha and Larni, who will talk about their view of the world.
Hello, my name is Mark Slater. I head up the digital program delivery function, working with Emma, who you met earlier. And my job is really to oversee and make sure that we bring forward the large programs. We talked about EPMA and our virtual desktop, and bring those through, engage with the trust and make them a success, and secure our adoption of those changes. And most of the work we do tends to take several months, involve several hundred people, and be quite multi-stream, if you like. And the difference really for COVID was we had to react differently. We sometimes, rather than having months to deliver, we had days or weeks to make things happen. And I want to take you through a simple example, fairly simple but a quite tricky problem, and a relatively simple solution. As Mark said earlier, quite often the solutions could be quite simple, but could be quite far-reaching in their impact. And the one I'm focusing on is the virtual ward round, as you see on the slide. The concept of the ward round is probably fairly familiar to people. The doctor walking from bed to bed in an inpatient situation, with junior doctors with them. The function there is to provide patient care, make sure the patient's notes are kept up to date, and we know exactly what's going on with every patient, and also to provide training opportunities for the juniors. Absolutely core function for an acute hospital. The problem with COVID was, for COVID patients, there are physical barriers in place for infection control purposes. So, as many of you watching will know, you can't actually go into the ward. It's a sealed unit. There's glass between the nurse station and the bay where the bed is, and the doors are controlled. To go into that area, a clinician needs to wear protective equipment, PPE, and they need to take it off every time they come out. Nothing can go through that barrier that could provide a source of infection, and that includes the patient's notes. So the challenge for us was, how could we continue this core function, but by minimizing the amount of contact and people effectively in that COVID area? You need to separate the team of people from the doctor effectively, but enable communication. So what did we do? In simple terms, we put a video and audio link up between the COVID area and the nurse station. And that was based on a simple concept of a pair of laptops on wheels with the necessary software in place to communicate, and also to transfer patient notes electronically. So let me hand over now to Dr. Ellis, a colleague who's actually used this in action to tell you how it worked for him.
So thank you to the team and all the contributors to those videos, and I hope you enjoyed those. Just at this point, it's worth noting that those of you that watched the main AGM on Wednesday, you will know that we have actually hijacked a very nice set over in the Lister Education Centre. But what we didn't manage to hijack were the cameras and the lights and production crew and all of the kit that filmed that very professional looking piece. But what we have got is our digital technical team and the comms team and the contents of our store cupboard to create all of this editing and this filming. So thank you to all of those. So moving on towards the end of our presentation then, and I said this in rehearsals and it didn't come out quite well, but I think that one of the things that in my career is that, you know, and I've been in IT for a very long time, is that whenever I meet anyone, whether it's outside or inside the trust, and I say that I work for IT, the first thing they say is that they've got a problem with their PC and can I help them to fix it? And especially for my colleagues watching this, you'll know that I haven't got the first clue how to fix a PC, as I've got Macs and iPads, and that's as much as I know in terms of technology. And I think that what these videos have hopefully demonstrated to you is that IT is more than just a technology piece. I mean, for sure, we've got a whole team of people looking after data centers and PCs and the like, very technical, but also predominantly we're here to use technology to solve problems for the business, for the trust, and work in collaboration. So hopefully that's what you've seen there. We've engaged, we've helped the problem, we've worked with them, and we've found that problem and worked together to deliver it. And that's what we will continue to do. So if we move a bit now onto, come to the next slide, please, onto the future. So what you see on the screen now is our digital roadmap. And I appreciate that's very busy. And I make no excuses for that, because clearly we are very busy, and our attention has been diverted for the past 4 or 5 months on some of the COVID response. But that's not to say that the work we did was valuable, because without fail, every piece of work that we did is going to be used post COVID-19. But really, just to focus on some of the main areas, is that the past couple of years is we've spent a lot of time in digitally enabling our nurses. So we've rolled out Nerve Centre. We do electronic observations now, and if you go to our wards, you will see our nurses holding handheld devices, taking those observations and putting them in to help with the deteriorating patients. What we don't have at the moment, though, is that not a great deal of our doctors necessarily have these tools at their disposal. So a lot of our focus for next year is that, and I sat in this very room 2 months ago and made a commitment to our senior clinicians that would be our focus. So we are going to focus on getting mobile devices into the hands of doctors, enabling them to take some of those notes digitally and make orders digitally and move things around the system digitally. So that is a big focus, and clearly the digital work happens we're only 50% of the way through our Windows 10 rollout. That should have been something that we finished, but it has stopped because of COVID-19. We're also looking at moving towards more cloud-based. So, for example, Office, that's Windows, that's Excel, that's PowerPoint, will be moving to a Windows-based version of the rest of the NHS. So you can read the slide, or maybe you can read the slide depending on what size device you've got. But hopefully next year we'll get the opportunity to come back and talk about some of the successes from that roadmap. So we've done a lot of talking. I'd now like to hand over to you in order to position some of the questions that I can see that have been streaming up the screen since we've been talking.
Great stuff. Thank you very much, Mark. Yes, we do have a good number of questions coming through, so thank you very much for that. Please do keep voting and posting your questions using the plus sign at the bottom right-hand side of your screen. You'll see there. You can put your question to the panel, but you can also vote on the question that you most want the panel to address throughout the session, and we will endeavour to get through as many of those as we possibly can. I'll start with the top voted question at the moment by some way. Panel, if winter pressures hit alongside a second surge, are you gearing up to enable more home working?
So I'll take that question and then pass that on to Mark. So absolutely, and at the beginning of this presentation, I talked about the VDI, or the digital workspace technology. So historically, what what trusts have done is buy more and more and more laptops and send people home with laptops. And we've done some of that. I think we procured around about 300 laptops at the beginning of this. But in parallel, we looked at the digital technology piece because that's not sustainable. So we've invested a significant amount of money into this virtual desktop, and it now enables people to go home. So we don't even need the kit. If someone goes home, we can actually text them with the login details and they can start working from home. We've got 250 licenses enabled, and we can continue to keep adding to that tally should we need it. I think there's some other pieces of work involved, Mark.
Yeah, if I can pick up from that. Thanks, Mark. Those of you who've been talking to your silver leads, and for those outside the trust, we have a command structure that we did all the way through COVID, which is very helpful when we're trying to coordinate big pieces of work like home working. And we've been working with our operational leadership, if you like, to prioritise how we enable people to home work, either through social distancing or because they've got a shield, or track and trace has said that they need to go home and work away from the rest of the team. So what we've done is IT will enable this change, but we wanted to put the decision making in the hands of the operation, in the hands of the trust. And so I've worked with my silver leads around the trust to come up with a set of requirements and a set of responses to enable people to work from home. And as Mark said, the lion's share of that is going to the new technology. So wherever a lead has decided that somebody needs to work at home and that person has their own equipment, where we can, we'll enable what we call the VDI, the virtual workspace solution. And that means, Mark said, you can log in from your machine at home. You don't even need to come in to be enabled. We can sort the whole thing out over the electronic communications and get you up and running. And we're in the process of rolling that out. And I'll just take this opportunity to remind Mark just to thank everybody for their patience. It has needed to be quite a big piece of work because, in terms of answering the question earlier, we need to make sure that we're teed up for later for another outbreak, and that we've got some equipment spare and we've got some licenses spare. So we're allocating it sensibly, and with the leadership of the trust closely involved in that, and we're in the middle of rollout now. We're well into 3 figures of VDI licenses enabled, and we're also handing out laptops where that's the most appropriate solution as well. So work in progress, but coming to fruition literally as we speak.
Thank you very much, Mark. And just to say thank you to everyone watching for the considerable number of questions we're getting through. So we haven't got a lot of time, so we just need to kind of get through these as quickly as we possibly can. Question to the panel. What's the latest news on the use of Microsoft Teams to enable better collaborative working with other trusts who are using this platform?
So actually, Ollie, I think that's probably one for you, isn't it?
No problem. And some of you may have seen some communication come out in the last couple of weeks regards NHS email. And it has been announced that Microsoft Teams is now going to be part and is part of NHS email moving forward. So the digital team are looking into how we can actually roll that out across the organisation. NHS email is currently being migrated over to a new platform, and we need to see what the impact of that is as well. But over the coming weeks, we certainly will be communicating out and understanding more about when we can roll this functionality out. It's also a good point to say that although it hasn't fully been approved by NHS Digital as yet, we have got a submission into them where the trust has recently approved for a Office 365 package to potentially go into place. So it's not necessarily approved as yet, but if that does get approved and NHS Digital allows to proceed with that, the hope is that over the next 6 to 9 months, we will roll out Office 365 in conjunction with a new NHS email platform, which will include functionality like MS Teams.
Thank you very much, Ollie. A nice general question now, which we can put, perhaps to other members of the panel as well. Do you think the new way of communicating is here to stay? Who'd like to pick that one up?
So there's various ways that we've changed the way that we communicate during COVID, and I think it's a way that pre-COVID we wanted to work in a different way, but we never had the means, the tools and the reasons to do so. So I think absolutely we should be using this new way of communicating to our advantage, whether it's to let staff work from home, to have meetings where we don't need to travel and incur travel costs, whether it's having virtual consultations with patients. I absolutely think it's here to stay, and it's now just taking the time to refine what we've already put in place to make it more efficient for our patients and staff. So yes.
Great stuff. Thank you very much for that. Just going to sort of move around the questions that we've got generally here. New question that's just come in. What do you feel are the biggest challenges with your current digital capabilities, and what future digital capabilities are you looking to implement?
Oh, that's a generic question, isn't it? So I think that I think the challenge at the moment is finding the right skill sets for us. So we've got some significant aspirations. When you look at the digital roadmap, then we've got lots of aspirations, and we really need to build a team in order to be able to deliver that for us. So it's really looking towards the ICS, so the integrated care system, around to our colleagues in other trusts around how we can better use resources between us in order to be able to deliver the right skill sets for the right project. So I think we know what we want to deliver. It's now just gearing ourselves up to deliver that, and I think that is a system-wide piece.
Okay, great. Thank you very much. Back to the most voted question as it's come through. How seriously are information governance and privacy concerns considered when implementing these new technologies?
So, as I'm the CIRO, the Senior Information Responsible Officer, is that I guess I should answer that. Is that absolutely is that we are governed quite tightly around GDPR. We've got toolkits that we need to complete for NHS Digital. Is that everything that we do has to go through a process of governance, and I think that some of our colleagues out there that have tried to implement applications will probably be nodding now with frustration the fact that we have, in their view, maybe slowed things down in order to ensure that we get the right level of security. So absolutely, is that privacy and security are our top priority for us.
Great stuff. We've had a number of very positive stories and patient feedback this morning. Some challenges as well, though, that have come through, and I want to link a couple of them together. This person's saying, it took 13 weeks to get a laptop and a VPN for myself and a colleague. Didn't feel very successful from this end. Another person said, the availability of BDI and Attend Anywhere is not communicated terribly well. How can this be improved?
So I think Mark touched upon this earlier, is that I recognise that there were some delays in the early months of getting kit to people. I think that the communication in the command structure in some areas didn't work. So we set up a bronze, a silver and a gold command structure in order to communicate through. And I think that there was a residual of the requests that fell between those command structures. And unfortunately, we didn't always deliver in those areas. And, you know, I'm not making any excuses. We clearly should have done, but we started to refine that process. And, you know, as it stands today, Mark, who we were talking a moment ago, is that Mark now manages that. So Mark's a very senior manager, and he's now overseeing that entire process to make sure that it works for us. So I would hope that moving forward that we're a little bit more swift on some of those requests.
Great stuff. Thank you very much. Slightly different question now. Are there plans to continue to increase the number of support staff equipped with laptops to improve the flexibility and mobility of working?
Yeah, I'll take that. Times are changing in terms of what Mark said earlier in terms of virtual desktop infrastructure, VDI. It means that more and more is actually going out there in the cloud, and more we're relying on devices like tablets and mobile phones rather than PCs and traditional laptops on desks. So what that will do, and what that will cause us to do, we'll look at how we need to structure our department moving forward, and how we actually need to provide fit-for-purpose service for the organisation. And effectively, what we think that will result in is certainly staff increasing in certain areas, potentially providing support in different ways. For example, across the trust at this moment in time, lots of people are working remotely. And I think there'll be many departments and divisions that will be surprised at how successful those staff are in terms of providing their services from another location. So we can be more remote, we can provide support in a more efficient and effective way. So in terms of directly answering the question, giving more desktop staff or more support staff access to laptops, that's probably not the future. The future is actually providing more flexible support at any site, at any time, at any place.
Thank you, Ollie, for that. I'm going to slightly change the focus a little bit here, because we've got a couple of questions that have come through, which talks about IT historically being seen to be a very male-dominated world. What are the opportunities for women in IT?
I think that's.
I'll take that one. So that's a really good question. So I'm going to take you back to an event that happened to me last year. So Ollie may remember this, but we were asked to go to the local college to give a talk about what do I need to do to have a career in IT in the NHS. So we walked into a big lecture hall, myself and Ollie, surrounded by approximately 100, 150 young men. There wasn't a single female in the room. And I remember coming out thinking, what can I do to educate the future generation that are female, that want a career in IT and digital? So I remember calling the college and I said, why did you have no female students? And her only response was, well, it only seems to be boys that want to fix PCs and take them apart. And it was at that point I thought, how do we let people know that IT is more than just PCs, hardware? I came into IT not even knowing what a network point was. I've been here 15 years. From the moment I joined, the IT department was fairly male dominated. We did have a number of women, but over the years we have increased the number of females in our department, and I've had many female leaders, female role models, female managers that I've looked up to. The project I spoke about earlier, Electronic Prescribing, was led by a digital delivery manager that's a fantastic female delivery manager. We have first, second line support managed by a fantastic female leader who's helping us today. I am conscious that in the room it seems to be male dominated, but IT is in no way a male-led profession. There's so many other things apart from kit that you can work on.
Thank you very much, Emma. And whilst we're on that topic then, questions come up about, to the panel really, about people interested in getting into a career in IT, into digital. What qualifications do you need?
I think in a word, it depends what role it is you want to do. So, I mean, entry level into IT for most people is a service desk, is a technical role, and then progressing through. So, you know, clearly if you wanted to be an architect, we would expect someone to have knowledge around that and to be able to deliver that role. But there are plenty of entry points into IT. So typically, you know, at 17, 18, 19 would be into a development programming role, into a service desk role. And I think the apprenticeship program gives us the opportunity to do that. So I personally have no qualifications whatsoever. And I don't mind admitting that I left school at 16. So, you know, it really depends on the specific role in the organisation. But to get a role in here, it depends on the person and the skill set and the attitude that they bring, rather than a college qualification.
Excellent. Thank you very much for that answer. A couple of technical questions I'd like to move to now, if I may. Question: why is the development of the patient portal only planned for 2022? Many NHS trusts already use it successfully.
So I think that there's different parts to the patient portal. So there's the part where you may want to get letters or book appointments. So I think this is about being realistic about what it is we can and can't achieve in the timescale. So some other trusts will be further ahead in their digital journey than we are. But I believe that as a trust, we're not ready to go down that route. We need better adoption in the trust, and that's what we're working on next year. So there is only so much that we can deliver in a year, and it's a case of prioritisation. So agree that it's something important, but I also need to be realistic about what it is we're offering to be able to deliver, and I think that's a 2022 delivery. You know, things may change. There may be something that moves that forward. I don't know.
Okay, thank you very much, Mark. I'm going to link a couple of other technical questions together, and I'm grateful to the panel for their answers. First one, does the Trust use robotic process automation? And a second question related to the resources available, why can't we use Zoom for meetings at the Trust?
Okay, so the RPA question then for Emily, and Ollie, if you could pick up Zoom.
Thank you,
Thank you, Mark. So in terms of robotic process automation, indeed we do use it. We've got quite a few robots that are working tirelessly throughout day and night, trying to or covering some of the administrative tasks on our systems. One of those, just as an example, is ensuring that all our referrals are processed on time and accurately, and indeed made available within our main systems. It's worth noting that as much as robotic automation is obviously a way forward and excites a lot of people, it's worth noting that it takes a lot of time and a lot of humans to set up a robot. Just around excitement, and I know that everyone talks about robotic process automation. We just need to be careful about what we do commit to.
Thank you very much, Emily. Again, I'm very conscious of time, but if you do have any questions that you'd like to ask, please put them now, post them now so we can make sure we get through those before the end of the session. Top rank question at the moment. In the slides, the presentations earlier, you stated that there were 1 million patient observations have been digitally recorded. Please could you expand on that?
So, Emma, do you want to say that?
Yeah.
And also I'll come back to Ollie for the Zoom question as well, so apologies for that. We'll come back to that.
So in answer to the 1 million of patient observations recorded electronically, so back in 2017, we implemented a project called Nerve Centre. So you may have noticed as a patient, when you come into the Trust, your observations are taken and they're recorded on a paper chart. They're stored at the end of your bed. For clinical safety reasons, we implemented a solution whereby the nurse can have a mobile device at the point of the patient's bedside. They will record the patient's observations on that device. It will calculate their NEWS score, which is a national early warning score, which tells you how much the patient is deteriorating. That's then automatically calculated to avoid room for human error. So our 1 million patient observations in the last year is based on, we have 720 beds within the organisation. On average, a patient has their observations recorded for every 4 hours. So that's the total.
Thank you very much, Emma. And if I may go back to Ollie for the question about Zoom, why can't we use Zoom?
Yeah, so pre-COVID, we actually invested money and we deployed brand new MDT rooms within the Trust in terms of the digital kit that was used within them. And we used a product called Starleaf. So pre-COVID, we already purchased the product. We already had the kit. And what we found that when COVID actually hit and we were looking at ways to quickly and easily deploy out video calling and instant messaging facilities similar to what Zoom provides, we found that Starleaf actually did that very well for us. And we compared that at the time with reports that were coming through about Zoom not necessarily being as secure as people would like. Zoom sessions were being hacked and inappropriate material potentially coming through those sessions. So it was something where we did make a decision that we would use Starleaf internal to the organisation for all of our video calling and all of our instant messaging purposes, because really we already had the tool available to us.
Excellent, thank you, Ollie. And if I can ask them how to keep their answers, I should say brief, because we do a number of questions to get through before the end of the session, but thank you very much for that. Question here, with the understandable focus on doctors and nurses during COVID, how is the digital workforce bearing up?
So I think that like most of the Trust are quite tired, is that more than probably about 75% of our team are now working from home. I think we've lost most of our offices, to be fair, so we don't have an option. So I think that's probably helped some of it, that people can work sort of at interesting times of the day and night and get rest at the right time. So yeah, the digital team are tired. Hopefully there's a little bit of a respite at the moment for people to recoup, but we are encouraging people to take holidays as well. So and maybe people will even start to go away now as well.
Thank you, Mark. A positive question here. Digital workspace is a fantastic solution. Will you be widening access to incorporate more staff in the future?
So I think the answer is yes. Is that I think this at the moment we're running a proof of concept. We've got 250 licenses, so that's the maximum. Is that my view is that this will become the technology that we will start to use across the trust, even at a ward level rather than external. So absolutely, we will be expanding this.
Great stuff. Thank you very much. And I'm going to pop through these questions if I may. Remote consultations, are they set to continue as this particular viewer thinks they are the way forward for many patients?
Absolutely. The Trust Restart programme is targeting 70-30, so 70 remote and 30 on site.
Great stuff. And question here, how are you planning on developing your patient entertainment solutions into the future?
Well, yeah, it's we think it's going to change quite a bit. At the moment, we provide internet services, we provide magazines, newspapers, etc. But there's other options available to us. We can get electronic books deployed to the solution. We can put TV services onto the solution as well. And really, what we want to start doing is engaging with some of the patients to actually understand what digital services they actually want to see when they come to the organisation. And that can help guide us in terms of what our strategy needs to be for the future in terms of patient entertainment. So there's almost no limit. The ultimate goal is whatever a patient has at home, if we can re-provide that same level of service, that same feeling of being as comfortable as possible with their surroundings, then fantastic.
Excellent. And I'm just going to pop through these last few questions. Question from our nursing cohort, how can nurses get involved with digital?
So, in fact, I was talking to our chief nurse this morning, is that we've got a CNIO, a Chief Nursing Information Officer, Linda Whiteley, who is out and about around the hospital, who is interested to speak to all of our nursing teams around their digital requirements. And we're also looking at a wider package around how we engage the nursing community in digital.
Great stuff, thank you. I'm going to link the last two questions together, if I may. One's a challenge and one's an opportunity. Person here is, what are the priorities in IT in dealing with issues that users are having? If they're having issues. The second one is, what do you feel are the biggest challenges with current digital capabilities, and what are you going to be looking at in the future? So wrap up on that.
So let me just quickly pick those up then. So the first one is that absolutely is that we have got outstanding incidents, is that we've got things that are broken that we haven't fixed, and whilst I apologise for that, is that clearly we've been focusing on enabling our workforce on COVID-19. So unfortunately, we have had to triage. So you may have a broken printer, you may have a broken mouse somewhere, and we will catch up with that activity. In terms of, sorry, the other second question.
Yeah, the future current capabilities and future opportunities in terms of digital. What might you be looking at?
So I think that really, I'd just take you back to my roadmap, and I think really the opportunities are around enabling our doctors, and we've got some great products in terms of Nerve Centre, for example. Is that there's a lot more we can do with that. So this is not about going out and spending lots of money. This is about leveraging lots of value from some of the products that we've got and getting better usage out of them.
I said a final question, but this is just a final question. Going forward, should we call you the digital team or the IT team?
That's a very good question. I think that I'm the Chief Information Officer. Some of my colleagues have got the title Digital, and we're called the IT department. I agree, and maybe our comms colleagues can help us with our branding.
Great stuff. Thank you very much. Just before I pass back to Mark to close the session, we are putting up some evaluation questions on the screen, if we may. So if you could take a moment just to fill those in. They are important to us and to the team to kind of get a sense of what worked for you through the session, what you enjoyed, what didn't work quite so much. So please do that. We're also posting an email address there if you want to send some questions directly that we haven't had the opportunity to address on the session this morning. communications.enh-tr@nhs.net is the email for that. But as I say, as we're posing the evaluation questions, if Mark, you'd like to wrap up.
Okay, so thank you for your time. Thank you for that hour, and I hope you've learned a little bit about what IT do or digital do, and that we don't just fix PCs and we don't do data centers, and maybe we've even encouraged some more females to apply for jobs here. So thank you very much, and hopefully we'll look forward to coming in and doing another presentation next year.